Welcome to Exam Sale. In this brief guide we break down the NCLEX-RN test prep syllabus so you can plan focused study sessions and pass with confidence. The NCLEX-RN blueprint covers 8 clinical judgment domains with weighted emphasis: management of care 18%, pharmacological and parenteral therapies 16%, physiological adaptation 14%, safety and infection control 13%, reduction of risk potential 12%, health promotion and maintenance 9%, psychosocial integrity 9%, and basic care and comfort 9%. Most questions are scenario-based, and the recommended difficulty levels and estimated learning hours help you prioritize study time and practice. Management of care is 18% of the exam, rated hard, and the suggested study time is about 45 hours with scenario-based assessment. You will learn to coordinate nursing care, make assignment and delegation decisions, and apply the rights of delegation while supervising outcomes. Expect to study legal and ethical practice like HIPAA and advanced directives, and build skills in advocacy, case management, discharge planning, resource management, and conflict resolution. Pharmacological and parenteral therapies is 16% of the exam, marked hard, with an estimated 55 hours of study and scenario-based testing. Focus on medication administration and dosage calculations, adherence to the rights of medication administration, and safe handling of controlled and high-alert drugs. You will also study pharmacological effects and adverse reactions, drug interactions, and parenteral therapies including maintenance of IV access, TPN, blood transfusion protocols, and electrolyte replacement strategies. Physiological adaptation represents 14% of the exam, is considered hard, and calls for about 50 hours of focused study with scenario-based questions. This domain covers assessment and management of acute, chronic, and life-threatening conditions across body systems, including respiratory, cardiovascular, neurological, endocrine, renal and gastrointestinal problems. You will practice recognizing fluid and electrolyte imbalances, interpreting ABGs, and managing medical emergencies with ACLS, hemodynamic monitoring, shock states, and post-resuscitative care. Safety and infection control makes up 13% of the exam, is medium difficulty, and recommends about 30 hours of study through scenario-based items. Learn standard and transmission-based precautions, proper PPE donning and doffing, surgical asepsis, and biohazard disposal to prevent infection spread. The domain also covers accident and injury prevention such as fall prevention, safe use of restraints, ergonomic patient handling, environmental hazard identification, and verifying client identity using 2 identifiers. Reduction of risk potential accounts for 12% of the exam, is medium difficulty, and suggests about 35 hours of study with scenario-based assessment. You will analyze laboratory values and diagnostic tests, recognize critical lab results, and learn the nursing responsibilities for imaging and procedural preparation. The curriculum emphasizes prevention and early recognition of complications such as postoperative DVT or ileus, pressure injury prevention, aspiration risk, and responding to vital sign changes that indicate deterioration. Health promotion and maintenance is 9% of the exam, rated easy, with an estimated 25 hours of study and scenario-based items. This domain focuses on growth and development across the lifespan, maternal child care including antepartum and postpartum nursing, and age-appropriate health education. You will also cover disease prevention through immunization schedules, screening for chronic conditions, and counseling on lifestyle changes and self-exam techniques. Psychosocial integrity is 9% of the exam, medium difficulty, and recommends about 25 hours of study with scenario-based questions. Expect to assess coping mechanisms, support clients through crisis and end of life, and identify abuse or neglect in vulnerable populations. The domain also develops therapeutic communication skills, boundary maintenance, cultural sensitivity, and strategies to support clients with psychiatric disorders or substance withdrawal. Basic care and comfort comprises 9% of the exam, is easy, and suggests around 20 hours of study with scenario-based assessment. You will learn to provide care for activities of daily living, assess nutritional and hydration needs, promote rest and sleep hygiene, and manage elimination concerns. The domain also includes comfort and palliative care skills such as non-pharmacological pain management, positioning, sensory support, and assistance with mobility devices. Use this breakdown to build a study schedule that allocates more time to hard domains while reinforcing medium and easy areas with regular practice questions. Focus on scenario-based practice. Review critical topics like delegation, medication safety, hemodynamics, infection control, and lab interpretation, and you will be well prepared for the NCLEX-RN.